You're listening to On the Way Home with your host, Emmy Kelly.
Welcome back to On the Way Home, the podcast where we explore the people and ideas shaping housing, health, and community resilience. I'm your host, Emmy Kelly, and today I'm joined by Victor Willis, recovering executive director and newly appointed lead of the Toronto Mental Health and Addiction Supportive Housing Network. With more than 3 decades in community development and over 26 years focused specifically on supportive housing strategy, Victor has helped shape some of Toronto's most innovative approaches to mission-driven real estate, community land control, and integrated housing supports. Let's listen in. Welcome, Victor. We're so excited to have you with us here today.
Oh, what a pleasure. Thank you so much. Great to be here.
We start this show with our signature question, and we'd love to ask you, what does home mean to you?
Yeah, I've heard so many people talk about home on the show and then reflecting on it myself. And of course, home is sometimes not a simple answer. And it's not simple for me. I think for a lot of Canadians, it's a house or a place. First 5 years of my life, my family rented an apartment in Toronto and then moved to Keswick, Ontario. Their dream was to buy a house, but it was very difficult because it was, a commute for my father. My mother was an at-home mother, but she had been diagnosed with a serious mental illness and saw and heard things that weren't there. So moving to a small town, in fact, was quite isolating. So the interesting part when I was reflecting on home is that, home can be a dream, it can be an aspiration. And then for some, as you try to work towards it, it becomes something else. And so I think that, and so that gives you some indication as to why I do the work that I do. Having grown up with somebody with a profound mental illness, gave me some insight into the challenges that people have navigating the world, and especially the difference between an individual's perception of what's going on and how the world may be perceiving things. So home for me today is a place where I can welcome people. The door is always open. Food is always part of that. And the home is always happier when there are more people in it. So today, that's the home that I've constructed, not the home that I came from.
That's amazing. Thank you so much for sharing that journey and how you've gone about experiencing and building your home. And I wanted to congratulate you as we jump into the show on being unanimously selected to lead the Toronto Mental Health and Addiction Supportive Housing Network. What does this opportunity mean to you, and what priorities are you hoping to advance in the coming year?
Yeah, and so the network is a group that's near and dear to me. When I was at PARC, and I was there for 26 and a half years, and when I arrived at PARC, we had no supportive housing. And during my tenure there, we started to identify, I started in 1999 at PARC and started to identify that housing was becoming a greater and greater need coming through our door and our drop-in, and understanding the kind of challenges that people were experiencing. And so the network was created, kind of came together about 23 or 24 years ago, loosely as a group of volunteers, all working together, specifically funded through at that time, the Ministry of Health and Long-Term Care. So this is before the LHINs and before other regionalized government platforms were put in. And we were all providing supportive housing. There were almost no guidelines. There wasn't a lot of clear instructions and standards. People, if you think about the beginning of deinstitutionalization and people living appropriately, not living in institutions, but living in the community, which was really the push. So this network came together to try and address that. But it was all sort of experimental. In the early days, we were just trying to do our best to provide people with housing. The over the decades since, with a variety of transformations in health policy, etc., the network started to share best practices, what to do in the event of. And the interesting thing about supportive housing and about the network is some of what we do exists in the support and care and partnership we have with the tenants. Another part of what we do is in all of the making sure that the buildings are in good state of good repair and maintained, and developing new units. So there are almost two different sets of skills and activities that are required in order to provide supportive housing. Although some of our members in the network, they strictly just provide the supports and in a variety of spaces. Others are doing sort of this 1 foot in the support and 1 foot in the development. And I know that you and Blue Door, it's those two things that are very different in some ways, but in fact are essential, partly because of what is understood to be supportive housing, because it's so, there are very few, there's not a lot of research, there hasn't been a lot done to provide the pathway. We've had to sort of do it ourselves, and with partners like the City of Toronto and with other partners in the network, so network partners. So fast forward to last November, and I had stepped down from being the executive director at PARC after 26 and a half years. And so I describe myself as a recovering executive director. But I knew that we sort of had a moment, both in the city as well as federally, and that really it was an opportunity to elevate and talk about what's required, what supportive housing does. There are a lot of, as you also are probably aware, inevitably neighborhoods are not welcoming of supportive housing for a variety of reasons. And I will say that it's not the full neighborhood, but certain pockets of people in neighborhoods like shelters. There's especially in Toronto, but I think that in other jurisdictions, we're also seeing this kind of pushback. So what do we need to do? Well, we need to educate, we need to talk about the impact. And in fact, that supportive housing is the simplest and number one answer to people who are on the street in encampments. And it's shown to work across the country. It in fact is, and then in fact, if you think of some of the work that's being done at Dunn House by Dr. Bazari and his team and Fred Victor, it actually saves money. So the thing about supportive housing is that it isn't just housing, although housing is, across this country, housing is so absolutely required and necessary. But supportive housing supports and resolves what we see, which is the failure of our ability to, as a right, house Canadians, and especially people who, in fact, may have a disability or a difficulty in staying housed. So seeing that, for me, it was like, okay, I put my hand up and said to the group, I'm available and I'd be happy to try and do this work. And let's see what we can do to build the activities and the impact of the network. And so that's my task. I'm 3 months in, so still early days, but I'm thrilled with the opportunity.
So maybe if you would just take us back a little bit more on your journey. I know you're doing this now and you're 3 months in, but you have spent more than 30 years in community development and 26 years focused on supportive housing strategy, which you gave us quite a flavor for there. Can you tell us a bit more about your journey?
Yeah, and so as I alluded to, I didn't come into this work, the standard way, doing maybe a BSW or an MSW or, I came into work in a community development sort of, I started off at Trinity Square Cafe, which was an opportunity for people to, after they'd been hospitalized, to get some education and then some practical work experience. And so I managed the Trinity Square Cafe behind the Toronto Eaton Centre for a couple of years. And partly because my training is actually in theatre. But if you're in theatre, you've probably worked in a restaurant or two, because theater doesn't pay. So I actually managed restaurants and then moved over to doing this work. But my personal experience and family experience, I think, gave me some understanding of what was required. So I managed the Trinity Square Cafe for a couple of years. And then the Gerstein Center did a call for crisis workers. And so I applied and was hired. And so I ended up working for the Gerstein Center for 10 years as a crisis worker. And that really gave me some insight into both how the system both works and doesn't work. And, the Gerstein Center is a great example of an alternative to institutions and the psychiatric system as an intervention. But I also got to see a lot of housing. So it's a mobile team. So we visited people all over the city. And so I got to see all kinds of places where people lived, and sometimes supportive and sometimes not. And it started to give me an idea of just what was missing in the demand and need. Did that for 10 years, had a brief stint in York Region at York Support Services Network. I was the interim coordinator for 310 COPE, their crisis service. And then the position of executive director came open at PARC, and I applied and was hired. And full disclosure, I was a relief worker for a number of years at PARC, and then I was also a volunteer and then on their board. So when the position became available, I recused myself and applied and was hired. And I also want to be really clear, I had no experience in running an organization or doing any of this work. So I think PARC took a huge risk in hiring me, but it was a job that I absolutely loved. And it was one where, Parkdale, there's something unique about Parkdale. And so you'll hear a lot about, the various things that are going on in Parkdale. Parkdale works quite collaboratively. It's a very, it's a neighborhood that is both, when I arrived, there was about 93% tenants. Many of the people who were living in rooming houses and boarding homes. So they would come to PARC. It had a lot of affordable housing by definition. And we know that over time, that affordability was being lost as rents rose, as buildings were being bought and sold. And the ability for Parkdale to be able to house as many people as it did affordably, it is being sort of eroded. So I arrived 6 weeks later. There'd been a process for renovating the building. 6 weeks later, we went to tender, my first time kind of in the midst of dust and trying to figure out what the hell to do. 18 months later, we had a brand new, a retrofitted building with an elevator, so it was accessible. And in the middle of that retrofit, the original design was to, in fact, have market units that would help to pay for programs. The government of the time, and you'll remember that there was a conservative government, Mike Harris, who had got in the second time by 1999. In the first round, had cut a lot of housing, and so there actually was a call for supportive housing, and we pivoted and changed our market units to supportive housing units. A bit controversial because we only had 10 units of housing; it was tiny, and we're a member organization, and so there was a bit of a referendum to kind of say, should we do this? And in fact, people said yes, we should, and then the big debate was, well, who gets to live in this place? And so a whole process of trying to determine who should live. But we had people who were sort of on a list who came from sleeping on a bench in High Park to having one of the buildings next door to Park had caught fire and was vacant for 8 years. Some of the tenants from that building moved into our housing. We had quite a range of people who moved into our 10 units. I remember being interviewed by Adam Vaughn at the time. He was working for City TV, and his question to me was, Victor, do you know that this project is the only social housing project in the province of Ontario? Now, I'm not sure if that's true, but it tells you that in 1999-2000, just what the gap was between what was needed, what was lost, and what needs to be built. And so that led us to subsequent housing developments. And there's an amazing team of people at PARC who all rolled up their sleeves, a great board who really kind of took a risk and said, well, let's develop more supportive housing. And that building that had been burnt down, that was 30 inches away from PARC, in 2006, the city offered it as a development site, and PARC threw its hat in the ring and developed it. And it is Edmund Place, one of the really important additions to supportive housing in the city of Toronto, because of the way that the premise, having people with lived experience being staff, the type of, it's a combination of both higher support. So some of the tenants will receive food and other meals, because they are not great at keeping their meals. Developing a program to help keep the place clean. So we would pay people to keep their place clean, because the boarding home allowed for some money. So there was this opportunity to say, okay, listen, if you can keep your place clean, we can pay you to do it, et cetera, et cetera. So it was an opportunity to do really innovative and interesting things. And so that really gives you a sense of, and then, fast forward to 2014, and we started the land trust because we could see that there was a loss of housing and of boarding and rooming houses in the neighborhood. 7 executive directors got together and created the Parkdale Neighbourhood Land Trust, and really beginning that sort of the resurgence of land trusts as a platform for taking housing off the market and putting it into community-owned land. And then the land trust, the first building they bought, PARC became the long-term operator of that building in 2019. But we also learned from the land trust, and so about the same time, we started to look for and acquire properties. And between 2019 and 2021, PARC acquired 4 buildings. One through MURA, so the multi-unit residential acquisition program that the City of Toronto has. 2 through a right of first refusal from an owner of a rooming house who wanted to let go, and there were 2 semis that were, and so PARC bought them with the help of an angel investor, as well as a foundation who was willing to be our banker for some of this. And then finally, a building that today is pivotal in PARC's plans to redevelop its site, because it's now looking to triple the density. PARC owns, with the City of Toronto, 1 building and then 2 buildings, and so it owns the block between Beatty and Dowling on Queen Street. So quite significant. The sad part is that they're all heritage buildings, and heritage is lovely. But as a great development consultant, John Harstone, once told me, you can have termites, you can have asbestos, and you can have heritage. And you can get rid of termites and asbestos. You can't get rid of heritage. And so if you have a heritage building, it's a lovely museum, but you don't get any money to provide that museum. And in fact, it's a museum that constantly needs work. So often these properties become available because the owners realize that it could be deemed a liability. So as you're hearing, I've learned a hell of a lot about housing, which is not, in fact, necessarily, and housing development, which wasn't, my acting career didn't give me any background in this. But over the years, it became clear that you have to be very creative, have a lot of great allies and friends, listen to people in order to move ahead with the kind of work that building affordable and supportive housing really requires.
What an amazing story. And so, like, from when you started to when you left, like, what was the number of homes that you were able to create?
Yeah, so to give you a quick example, I mean, when I started, we had 1 building that was retrofitted. It had no housing. We added 10 units. And then over the course of my tenure there, we added 6 other buildings. We're awarded a 7th, which is going to open this fall. and that's 11 Brock, and now redeveloping the site. So moving from 0 units to about 200 currently, and that will then go to about 400 once the development happens, which will be phased over time. And not somewhat controversial. There are perceptions about how many of those people should be living in any one place. And I think that the assumption or the title of supportive housing, as I alluded to earlier, can be deemed problematic or at least controversial. The thing is that you probably heard in the news 2 weeks ago that there are all kinds of folks who are now in the shelter system and on the streets who are part of the developmental sector. We're seeing a greater and greater loss of affordable and supportive type housing, and we need more. And from a health population point of view, so there are 40 million people in Canada. There is an understanding that if somebody has a diagnosis like schizophrenia, which is a major mental illness, it's about 1% of the population. Now, not everybody has severe, but let's just use that as one measure. That would mean that you could infer that we might need 400,000 units of supportive housing across the country. We have nowhere near that, let alone all of the other complexities, intersections of health, physical disability, etc. All of it is supportive housing. If you've got a major physical disability and you need specific accommodation, well, that's probably going to be supportive housing. If you've got an intellectual disability, you may need supportive housing. If you're aging rapidly, you may need supportive housing. If let's say you've just come out of the provincial jail system, 50% of the people who come out of the jails end up on the streets. You could use supportive housing. The thing is that it's a wide range of the population, all who have different needs, all who will need at some point some type of supportive housing. But the other thing that we've learned at PARC is that some people don't need it forever. And in fact, recovery is a core part of this, so that people can recover. And even though they were diagnosed and told that they might never live independently, are more than able to live independently. And so their need of a higher support diminishes. They can graduate to less supports and even to just live independently without any kind of supports. But you can only do that if you get off the street, if you don't compound the trauma and difficulty of not having a place to live, and all of the other things. As when I talked about the various groups and profiles, these are all people who may in fact have be discriminated against, not have the same access, and of course will suffer quite profoundly on the streets, in shelters and encampments.
You did touch quite a bit there on who might benefit of supportive housing. And I'm wondering, I never like to make the assumption that all of us on the show or those listening to the show know everything about the space. So I'm wondering if you can describe for us a little bit of the difference between supportive housing and affordable housing.
Well, and I'm sure I'm thinking about some of the people you've had on your show. So you've had people talk a bit about the housing crisis and, why affordability is such an issue, and a greater and greater issue. So when I talked about what's going on, what's happened in Parkdale over the last 26 years, a lot of people could afford to live in private sector housing, and it was affordable as far as the market goes. And what we've seen, and has been written and talked about numerous times, is that the market is the market. And so it doesn't care whether it's affordable or not. It just cares about what the market will offer. That means we now need more affordable housing. And, Canada is well below the OECD average of how much affordable housing, social housing we should have. We're at about 4.5 or 5%. We need about 7 or 8. We have goals of maybe 15 to 20, and there are some great jurisdictions when you look at how much they have. many of their citizens are then able to live very differently because they're not worried about how to pay the rent. We'll then add on, so you've got affordability, and so you've got social housing and affordable housing, and lots of great providers out there doing that. And then you've got the added challenge of somebody who may in fact not be able to work, may in fact have the kind of complexities and challenges that from a human rights point of view need accommodation, and therefore are going to require some extra help. It's both affordable housing, so supportive housing is affordable, excuse me, but it has those supports. And the whole premise of most of the members of the Toronto Mental Health and Addiction Supportive Housing Network is that we have a variety of policies and practices that help to prevent eviction. People will have if you've got a profound mental illness and a history, and if it recurs, I liken mental health. I look at what happens for cancer care, and you could have cancer, and you know that you could be in remission for a period of time. It could come back. You're in fact flagged for most of your life that in fact you've had cancer. People sometimes have multiple cancers. And we're pretty good about supporting people and having a very robust health system to support them. If you have a mental health history, and that could include an addiction, but really we're talking about that connection to addiction as a mental health issue, really. You don't have anywhere near the same level of support. It's not embraced in the same way. There isn't the fast intervention. So we've got this sort of disparity in the way that we look at supporting people with a major health issue and a major mental health issue. This is the reason that we need supportive housing, so that therefore workers, supports, the housing provider itself can understand that its role is to support this person to obtain their housing. And if they do it well, an individual can have all kinds of ups and downs and difficulties. They can have relapses, but the goal is to keep them housed if at all possible. There are some gaps in the way that the Residential Tenancies Act works. There are some real challenges for housing providers depending on having enough of those wraparound supports. There is a real debate right now and work that needs to be done at the provincial level, because the province, in the way that health funding works, it's transferred, our taxes go to Ottawa and they're transferred back to the province. So in Ontario, those health transfers come back, and we would want to make sure that that funding is dedicated to the kinds of wraparound supports that make for successful supportive housing. There is currently no clear pathway. There is no strategy at Ontario Health. There is, in fact, a gap about supportive housing. We're even having difficulty getting what the baseline numbers are. So there's some work to be done, and that is part of the work, I think, of the network, along with all of our other network partners. And there are networks of various kinds across the province who are all looking at this to be able to say, what do we need? How much of this do we need? And how does an organization that is expanding their supportive housing, how do they get access to this so that they can continue to bring people off the streets and out of encampments, and to provide dignified places for people to live so they can recover? So that's part of the work. But in a nutshell, it's housing that's affordable with support.
And who would you say is best equipped to deliver on this type of housing? And I'm guessing, as in most cases, collaboration is key. And so what does that look like in terms of which community partners need to be at the table, nonprofits, municipalities, and so on?
It really is for the longest time. So in the early days of the network, it was, enlightened or mission-driven individual groups. And then we started to come together and say, hey, we do something that's unique and required. We help society with this piece. We're helping people to live better lives. And so, yes, it's a connection between. So I've described what we need from the province, which is a funding partner that helps with this. Every municipality also needs to understand what it is. There are issues about zoning. There are all of the things that might happen for any kind of housing, happen for supportive housing. But with the added stigma, then we actually need to do some extra work. Zoning, the history of zoning in North America and Canada is one of exclusion, right? So we have lots of exclusionary zoning, single family dwellings everywhere. And, a lot of the research is now pointing to the fact that in fact, so certain equity groups would never get to live in certain parts of the city just because that's the way it is. And so that discrimination is also experienced by people with mental health and addiction histories. So you've got the whole zoning regimen. So you need planning on your side. You need counselors. You need an administration. You need funding. And you need neighbors. And in fact, at the center of this, you also need people with lived experience who understand this, who can be very much part of the, to talk about how important it is, but also understand the design and development. So PARC so I got a great education at PARC in that it was a unique organization. Half of the board of directors were people with lived experience. So it meant that I had, half of my bosses were very clear about what their expectations were and what their experience was. And probably not as easy as a high-powered board of rich individuals who can make things happen. But in fact, I felt that when I was able to talk about the issues, there was a level of authenticity and authority that my board gave me, because I knew on any given day I'd hear from people about what their experience was. I think that is an important piece. PARC today has about 140 employees, and I think that over half are people with lived experience. It might be closer to 70%. And that was very much part of the ethos and motherhood statement of the governance. So that people with lived experience throughout the organization. I think that those are, so, anytime you have the partnerships and the kind of voice, it has to be centered around the voice of the people who are experiencing this the most. And that's, of course, the people with the mental health history and with the trauma who have lived and understand.
That's really interesting, the model there, and an awesome example of building around lived experts' experience. Can we go back to your tenure at PARC? And you spoke a bit about expanding the portfolio from 1 building to 7 now, in collaboration with the Parkdale Neighbourhood Land Trust and City of Toronto.
Yeah, I mean, that was, and I'll tell you, it was with numerous partners. Habitat Service Community Services was our partner with Edmund Place, because we didn't have enough money to be able to do this. Supportive housing doesn't pay for itself if you just build it and populate it, because the supports actually cost a little more. What we know is, if you look at the larger ledger, they actually save money. So they don't, but usually it's, might be between what the municipality is paying and what the province is paying, or different ministries. So Habitat Community Services was our first partner in helping us to provide subsidies to the units, which was really essential. Later, Habitat was one of the organizations that was part of creating the Land Trust. Working with City Council was another one of the partners. But in fact, the unique kind of environment of Parkdale was that we had about 30 organizations that were all invested in community change, and we would meet regularly. So we had a robust set of partners. Not all of them were involved in housing, but they all believed in community improvement. And so that became one of the driving activities as well, which really helped. So very uniquely, unlike situations where you may have a neighborhood that doesn't have many assets, I mean social assets and resources. it's a lot harder. Whereas in Parkdale, it's pretty uniquely possible as long as you have good relationships and you talk to people and you're collaborative. And we would have a monthly table and a steering table and looking at a Parkdale plan. This changed the way that we were able to look. Today, so PARC is, one of the successful organizations, but in fact, there are a number. And when we did some research with the Land Trust back in 2016, 2017, we were noticing a loss of affordable and housing, predominantly privately owned. With the most recent multi-unit residential acquisition programs, as well as the city's investment in the Parkdale Hub, and with all of the other providers, we estimate that we're close to 20% of social housing that is community owned or not on the market. That's unique. So there is something to be said for working together and those collaborations and partnerships. I mean, and the other thing is, there's a lot of churn in our industry, right? I mean, people don't stick around in leadership roles. So it's great to see you at the Blue Door, and hopefully you're staying. The piece is that this work is assisted, especially if there are good relationships that have some length of time. I was around for 26 years, probably because I just didn't have the ambition to go anywhere else. But really what it did is there were a number of us, and Maureen Fair from West Neighborhood House, there are leaders who were there for quite a period of time. And that actually is also part of what is helpful. So when you start to think about what are the indicators and factors for the some of that success, those are some of the things to look for. Parkdale is kind of like a lovely, unique space. I hope it's not a unicorn. I hope it's replicable. And we've learned some of the factors and opportunities that have created that replicability. And PARC has been able to benefit from that. So today, PARC has quite a bit of, has housing, has partners. When the safe consumption site was closed at the Parkdale Queen West, we were there with them, standing with them, and they are an important partner of ours, even in the Heart Hub that is the, and I've just got a block on homelessness. What's HEART stand for? Do you remember? Anyways,
let me search it up.
Yeah.
I'm blank too.
Yeah. So it's one of those acronyms.
Homeless and addiction recovery treatment.
Right. So there's a hub, and PARC is one of the partners with that, among many others, as well as some housing partners as housing comes online. So, but we when there were pushbacks on issues of homelessness, we were there for each other. Many of the organizations came together and rallied and understood that you're not alone, and that in fact the real piece is having each other's back, which is an important part of just the ethos of doing that work together. So it's a very rich and important set of activities and some amazing outcomes that are part of what the Parkdale neighborhood supports. And I think that there are other neighborhoods in Toronto and across the country that have similar features, which can then be, these are some of the indicators that will help for successful investments, which are required. I'm getting a little off track from supportive housing, but my apologies.
No, not at all. And maybe if you can just delve into a little bit more about like what that time taught you about community control of land and long-term affordability.
Yeah, I mean, so we've had numerous, over the last couple of decades, there have been numerous sort of attempts to try and create affordable housing, and especially with private sector partners. But often the affordability would be time limited, 15, 20, 25 years. And then whatever governors that would keep it affordable would be removed, and therefore rents would rise, or there would be a change. The thing about community control for both PARC, but also for the Land Trust and for other organizations is usually it's in perpetuity, so that will remain affordable. And even if there are market units in, so somebody buys a building through Mira, and there are market rents there, over time those rents will come down, because there isn't the profit motive, so there's no need to take investment out of the development. The real motive is how to put money back into the building. And then the other part about community control is then being able to, if there is money that starts to be available, it can go into funding other acquisitions or other projects. So there is a need for these kinds of tools for not-for-profits. And from time to time, they may work with a private developer, but you want to make sure that you have long-term control and ability to make decisions. And right now with the market, it's probably a great time for exploring those kinds of things. A number of the private sector developers in Parkdale who bought rented buildings, the rental market has changed pretty dramatically, and they're not making their returns, and they're now selling those buildings. So it's really a unique time for investing in social housing.
And so you're often referred to as the social purpose real estate practitioner. I'm wondering if you could tell us how stabilizing commercial tenancies or acquiring property based on mission become powerful tools for poverty reduction and neighborhood resilience. And maybe also, I'm just thinking too, because to your point of supportive housing, it is a cost saver for our nation, but it is, when it's looked at independently, it's difficult to make the pro forma work. And so I'm wondering if you have any tips or clues for our listeners of how you were able to make those acquisitions and operations successful over the years. And like you said, like a bit about that long-term work. It's very easy to make a project work for 1 or 2 or whatever years. But when we're talking about supportive and affordable housing over the long term, I think that's where we see some of the challenges in nonprofit housing. So if you would share a bit.
Yeah, and so it started off before I arrived at PARC, but PARC was renting a space in a building that went into receivership, and the board of directors at the time didn't want to move and said, well, maybe we should buy the building. And of course, this is a board of volunteers, half of whom are people who benefit from PARC services. They didn't have any money, but they put together a business plan. And so, whenever I talk about the history of PARC, I talk a bit about timing and then having a proposal. So always having a proposal in your desk so that when the timing is right, you pull it out. This is essentially what happened. It went into receivership in 1991. Well, 1991 is when the Bob Rae government came into power. And in the first year, they were living up to their mission, and PARC presented a business plan. And the government agreed that it would be better for PARC to acquire the building, and so they helped to buy the building. It had one very contentious commercial operator in it, who I remember at the board meeting actually trying to, voting to let go of the liquor license that they had, because there were all kinds of activities that weren't good for the neighborhood. And then when we renovated, we had a great architectural team in Hilditch Architects who really encouraged us to think of all the space that PARC would need, and then what else could be done with this commercial space. And so we had a bit of a conversation with the board and said, well, what should we do? At that time, I was like, well, should we have a Mr. Submarine, like an anchor commercial tenant? It could, 10 years later, it would have been a Starbucks, and 10 years later, but the board, to its wisdom, when we looked at what was possible, we said, listen, why don't we make sure that this asset is available for other charities who are scrambling and looking for space? And so the board passed a resolution to say we are going to rent space to other charities and not-for-profits who are a benefit to the neighborhood. We weren't sure that that was going to work, but within 2 years, we were fully rented. So, probably about just under 10,000 square feet of various kinds. Some of those tenants are still with us today. So Working for Change is an amazing organization. It is a psychiatric survivor business entity, and they're one of our strongest partners. They rent space with us. West Neighborhood House rents space. Queen West rents space. For the very first tool library in the city of Toronto, started in our basement. The Parkdale Community Food Bank, which now has their own space, was in our basement renting space. So we've had Creating Together, which is an amazing parent-child resource center, was there for 20 plus years. We had long-term tenants who were a benefit to the neighborhood. When we did our rent reviews, we would take a look at what was being charged on the commercial in Parkdale, and then we would charge in the bottom quartile of the rent. So we would say, here's what's being charged, and we're going to charge you, in the very bottom, in that sort of in that quartile. So mission-driven, understanding, not a lot of turnover, and turnover costs money. All of our partners understood that, we were trying to make sure that our bottom line could be covered, so we could pay for renovations, we could pay for programs, and we had control, but also they had control. And this is a time when numerous organizations were getting eviction notices from their commercial properties. So sometimes social purpose real estate is a part of having private commercial interests, which are great, and there's lots of great examples of that across the city. Ours was a little more unique in that we were very clear. We're here for other charitable not-for-profits. They all have rent lines, and we understand each other. And even in the negotiations for increases, it was done in a very sort of like, here are the facts, here's what we're trying to do. And we would come up with a sort of a collaborative way to move forward.
I love that. That's a awesome idea. Very cool. I'm just thinking about our social enterprise and our housing. We've thought of ways, but haven't yet structured that out. But it would be cool to make that work.
And I think that there is a whole sort of community practice, very much in the States, but also here in Canada. And I think more and more there are groups who are looking at how to support each other in our ability to provide good services, and what does that mean? And I think that's an emerging kind of practice and opportunity under social purpose real estate. And of course, United Way has been a very big partner in. They've got a grant that helps with this. So if your listeners, if anybody's outside of the Toronto area, United Way is in Peel and York region, and they are looking to create hubs and other kinds of investments, especially in areas that don't have the kinds of services, and then bringing together a variety of services under one roof.
So from your perspective, I know we need to wrap up the show over the next few minutes. So you've talked a lot about the homelessness, mental health, and why supportive housing is so needed. Could you share a little bit about how investing in supportive housing impacts society more broadly at a large scale, including public health, safety, and economic stability?
Yeah, well, I mean, I think your listeners just need to Google Dunhouse and Andrew Bazzari and take a look at, they've had the benefit of the Katusa Foundation, which has done a health economic analysis of what supportive housing provides. And just in that relationship between UHN and that housing project, they've saved over $1 million in the 1 year of operation. But when we start to think about this on a broader scale, and there are fabulous examples across the country, what do we see? Well, we see people who you might have had a group in an encampment, and they're now living in housing. And so, from an investment point of view, you can have your, like Canadians can have their parks back, and they can actually have their streets back. These are not, and these are not sort of pipe dreams. These are, in fact, this is what supportive housing does. And so there is some investment. The capital it required. So going back to, who has the money? Well, we give the federal government tax dollars. They now have a new mechanism for affordable and supportive housing. That's Build Canada Homes. We're hoping to be able to assist them. The network did a report last year about what characteristics and factors make for more successful and durable supportive housing. We've got a toolkit that we're working on this year. And the premise is to make sure that if someone's going to do some supportive housing, we can make sure that they understand how it should be built. All of that input is from supportive housing providers. Unlike having an architect or a jurisdiction or a municipality that says, hey, here's a building we're building for you, we're going to provide them with the toolkit to say, this is in fact how it should be built. This is where you need to spend the money. This is how this actually reduces the operating costs over time, improves the state of good repair, and in fact improves the dignity and kind of housing. And that's not new. There are, I did a tour last year of Alberta, Edmonton, and Calgary, amazing examples of groups who are doing fabulous work. These investments across the country change the way that our country understands itself. Right now, there's this, I think, a belief that, well, there's just homeless people, it's never going to change, and there's nothing we can do. And certainly, if you think about the kinds of challenges that we're experiencing just for middle income earners, those are very valid and real. But we actually can. And amazing enough, some of the people who we get off the street are going to be actually working again. We're going to be spending less money, the money that we need. So if you want your emergency department to, in fact, be able to work a little better, let's make sure that it's not supporting people who don't have anywhere to live and are much more likely to be in the emergency department. 911, all of these services that in fact get overwhelmed because we've got people who are not living in a dignified and rights-based manner. It costs us more. So really, it's just the right investment. And this is something that is both understood jurisdiction by jurisdiction, but we'll go back to that collaboration, which is you have to have both the municipality, the province or territory, and the federal government all rowing in the same direction. And that's, of course, some of the advocacy that needs to be done in order to get that to happen.
I would add to that too, some of the work that can be done even across departments at each of those levels, because like you said, we know that when we do certain things, we are creating cost savings. It might not be for the same department that we're creating them in, right? So we need to look at how are those, how's that cross collaboration happening?
Well, and sorry to interrupt, but I think that the piece that we're talking about is, when you look at various auditors or groups that take a look at budgets in governments, there is an idea of whole of government. And for the longest time, I think that various ministries and departments kind of kept their budget, and which might have made sense at some point, but really it doesn't, because it actually has to be a whole of government, a whole of impact. And so if something you're doing is saving somebody else money, we need to sort of say, well, that actually is something that we all benefit from, because we all pay into and expect civil society based on our taxes and based on our ability to live together. That's the piece that you're talking about, and I think it's very important. Recent report from the Financial Accountability Office of Ontario identified that we're actually losing ground. There have been these sort of minor inputs in supportive and affordable housing, but essentially, if you look at inflation, et cetera, and population increase, we've lost 10 years of sliding back. We're not making the investments that we need to make. That's really important. That Financial Accountability Office report should be taken a look at.
Well, we're at time, Victor. But that was such an interesting conversation. I so appreciate you taking the time with us today, sharing your insights, your experience, and your leadership, and the incredible work that you've done with Toronto Mental Health and Addictions Supportive Housing Network, as well as PARC and the Parkdale Neighbourhood Land Trust, and really helping to put supportive housing on the map in Toronto and creating real lasting impact for communities. We're so grateful for your advocacy. And society as a whole. So thank you.
I mean, thank you so much. And thank you for what you guys are doing. Having this opportunity to talk about the good work of all the people that come on is essential. So thank you.
Thanks so much for joining us on the show today, Victor.
We'll talk again soon, I'm sure. Bye now.
Today's episode featured Victor Willis, lead of the Toronto Mental Health and Addiction Supportive Housing Network, whose decades of leadership highlight how supportive housing can strengthen not only individual lives, but entire communities. His work across PARC, the Parkdale Neighbourhood Land Trust, and citywide partnerships demonstrates the power of mission-driven real estate, collaboration, and long-term affordability in building healthier, more resilient neighborhoods. Thank you for listening to On the Way Home, a podcast brought to you by Blue Door. Stay tuned for more conversations with leaders advancing supportive housing solutions across Canada.
You're listening to On the Way Home with your host, Emmy Kelly.